Hi guys, so this month we're going to look at ACL, so the anterior cruciate ligament. So we're going to take you through what the anterior cruciate ligament is, look at some of the smaller rehab exercises that link in with what physios do, and then look at some more rehabilitation, aggressive sort of strength, balance and coordination exercises that go on post ACL injury or surgery, so when we get further down the line with that. So the first thing is, really, what is the ACL, the anterior cruciate ligament? Well, it's the ligament that holds the femur and the tibia together, okay? And it basically stops, if this is my femur and this is my tibia, it stops the knee joint traveling too far forward, okay? So a lot of the time it becomes injured, or you hear like one of the symptoms or things that you hear when the ACL is torn or injured or strained as a pop. And the reason for that is that the knee joint has traveled too far forward, and that's when you have that tear. So it tears to protect the knee joint itself, okay, and stop really the femur traveling too far forward. Generally, these type of injuries occur when there is too much excess forward motion placed upon it. So in sports such as skiing, football, rugby, anything like that, where you're stopping, turning and accelerating and changing direction, or really have to suddenly decelerate motion. One of the big things we're looking at with ACL is the role of the ACL in tandem with the hamstring. So one of the things we need to look at is making sure, A, we've got strong hamstrings, but they're good at controlling eccentric motion. So when slowing down, making sure that the hamstring's actually lengthening slowly to control how much flexion there is in the knee itself. So what we're going to do is really have a look at our role as G2G coaching when it comes into rehabilitation and how we work with physiotherapists or any other clinician. So the first thing that we do is, if we get a referral or someone comes up to us post ACL reconstruction, or having had a strain or a slight tear that doesn't actually need surgery, what we'll do is we'll do a full assessment, and then we start to look at the movements that they can and can't do and really assess, how do their glutes fire? How strong is the hamstring? What are their quads like? And does the VMO stabilize? That's the vastus medialis, which is the muscle that runs down the medial aspect of the knee here. From there, we'll then work with the physio to find out what the member or the client is doing, and we'll really say, right, what can we do with them, what can't we do? And often this means that the physios get them to a really good point where they're back to sort of activities of daily living, pain-free, they've got good movement and good basic strength around that knee joint, and they can do most activities pain-free. However, they'll always feel a little bit vulnerable, a little bit weak. And that's where we come into play. So what we do is then start to work on these weaknesses because we have more equipment, because that's what we do. We're strength coaches and we understand movement. So we'll look at things like how we work with the hamstring, how we work with the glutes, and how we work with the quads, which is what we're going to show you in a second, and take someone through a progressive program of doing this so that they understand what's going on and understand why they're doing it, so we can then start to load up bigger and more aggressive movements. And Aidan's going to come in and show you some of these more aggressive movements that we put into play, such as hopping and bounding and jumping. And that again is phased in, and that's periodized after someone can squat properly, after someone can lunge properly, and does have good landing mechanics, so that when they do it, they're not going to re-injure it, and they're already strong through that hamstring and glute complex. So one of the first things that I mentioned was the role of the hamstring in relation to the ACL. So making sure we've got good hamstring control, good hamstring stability and strength. Now, we could do, and what physios will do, some manual resisted work and resistance band work with it. When we take over from that, often what we need to do is help with mind-muscle connection. So working on them actually feeling the hamstring work and how to create downward pressure. So we use something like a Swiss ball to do that, and working on what I mentioned earlier was eccentric control. So that's where we'd use something like a tempo control in here. So very simply, I just put my feet on the Swiss ball here. Option one is just to keep the butt on the ground. Don't do anything, don't lift the hips, and push down into the ball and curl in. Feel your hamstrings here, and then when you extend out and keep pressing down into the hamstrings. Okay? So you should feel the hamstrings really work on the way in, but you should feel some connection and eccentric control as the legs extend there. You can then progress this just by simply taking it to one leg, so it feels harder and more isolated. And then as you get better at it, we can then just work on squeezing the butt and lifting up into that bridge, and then curling in. And again, we can do stuff like, once we hit here, we pause, and then we just control it out for a 2 or a 3 count. Like so. So the next thing we're going to look at is the quads. Okay, so really what we're going to do is just a simple leg extension. Again, physios will do this. We'll add a little bit more load, or when you're in a gym environment and you have a physical leg extension machine, you can work with one of those as well. But really just getting the position of that tall spine with the ribs hidden, like we did when we're presenting back pain. You want to get that position, have a band wrapped around the bench and then wrapped around your ankle. What we want to do is really just extend through the quad and pause at the top and get the feeling of this working. Okay? A lot of people just go up and use band momentum. They're not really doing anything there. Come up and pause, feel the quad extend, and then come back down. Now when you hit the top, another little tip is hit the top and turn the leg out and try and feel this VMO here go hard. And what that'll do is help you stabilize the knee joint. Now, this basically stops the knee feeling too much lateral motion, essentially, is what the vastus miliaris obliquus does. But it's a big tip on leg extension is up, pause, turn out, and that will get that to fire up there. So one of the things with working the quad and the VMO is obviously it's going to help strengthen and stabilize the knee joint a little bit, but it's going to help it feel stability, particularly when stop turning and accelerating in sport, because it's going to reduce the amount of torsion force that the knee actually feels. The muscles are going to do the work to stabilize it and stop all these ligaments inside stretching or having to overwork in essence. Okay, so the next thing we're going to look at are glutes. So one of the things we want to really look at things that support and help the hamstrings, and one of the things is the glutes really, and they help control direction and stability as well as being really strong muscles that develop power, force and strength in the body, particularly in forward and lateral motion. So what we want to do is just start to incorporate some glute bridges. So we've put a glute loop on really for proprioception, to make sure that you're moving through your hips and not through your lower back. So one of the things the band does is it forces a little bit of external rotation, which is going to help glute med fire up. So when we set up, again, we set that pelvis and rib cage position. We're going to do what we call rooting the feet, which we've been through before, which is we would grip and twist the ground a little bit. So I feel these glutes just start to fire up, and then from there I drive up through both glutes and come back down nice and controlled. Reset position, drive up. Again, you can do things like having pauses at the top and coming back down. Other things you can do to progress are eventually add load across your hips. So when adding load, you can use things like dumbbells, bars, kettlebells, or even just a band across your hips that's tied down to something will help as well, just to progress that. From there, failing that, if you're just training with body weight, we can get you to do the same glute bridge, coming to the top and march. And just feel the difference in stability between each side.
Do you want to try and relate that to sport as well?
So, again, the march will relate to single-legged movement, transitioning weight and force onto one leg, which is then going to help with stop, turn, and accelerate. You know, changing direction pretty quickly or pretty aggressively. So all these sort of things are really good for that. Other thing, if you're just looking at the strength side of it here, instead of the left and right or the asymmetrical aspect, are going to be actually doing the glute bridge single-legged. into there. And again, you'll feel a difference between left and right, but there's not so much proprioception involved as with the glute bridge march. So we looked at the Swiss ball hamstring curl. Here's just the next progression from there that we're looking at, the dual adjustable pulley or the cable hamstring curl. So really this is starting to add load now and add strength. And what you're going to feel with the cable is as you start to hit the top of the curl that you can really get a forceful or a long contraction or a deep contraction of the muscle, because it's all about that end range kick and end range movement using cables and elastic bands. So what we do here is we set up like so with the cuff on. Again, instead of using an isolated machine, set the pelvis and rib cage, because that means you're stabilizing your own body weight so you can feel what's going on instead of just going onto a hamstring machine. And yes, you're using the hamstrings, but you just end up kind of flopping and moving all over the place with the torso. So set position here and then curl up and pause and then back down. And again, we can put all sorts of tempo controls in here with that. The other thing that's really nice about this is on the standing leg or the pillar leg, you can actually get that glute to engage to help hold you in position, okay? So you're doing more than just working the hamstring. The opposing side is working to stabilize the body as well.